According to a recent survey done by WebMD, the majority of doctors across the country believe that medical marijuana should be legalized nationally because it can deliver real benefits to patients. The legalization of medical marijuana nationwide has been an ongoing argument in the United States for years. Many people agree that marijuana can provide a medical benefit and that there are real benefits, along with the opposing crowd that believe marijuana is a drug and would be considered a danger to the community if made legal. So what exactly is marijuana? Can it actually provide medical benefits? Today I will discuss what is marijuana, how it can be harmful or helpful to the human body, and can it really be considered a medicine? Becoming aware of the scientific facts can help you as a citizen better understand where you personally stand on medical marijuana. So what exactly is medical marijuana? The National Institute on Drug Abuse explains medical marijuana as a mixture of dried, shredded leaves and flowers of cannabis sativa, also known as the hemp plant. Marijuana can be smoked, brewed within tea, consumed within food, or even inhaled with a vaporizer. The main ingredient in marijuana is THC, along with 500 other chemicals related to THC called cannabinoids. When THC is consumed, it quickly enters the bloodstream, and a sense of euphoria and a sense of relaxation hits the user. Users have reported many side effects, but the most common include increased appetite, altered perception of time, laughter, and heightened sensory perception. Although it is important to remember that the drug affects all users differently. Medical marijuana is specifically the use of marijuana grown by the government for medical purposes only. This is where many people disagree. Is the use of marijuana more beneficial or destructive to the human body and the community around us? Specifically, THC, the active chemical in marijuana, has proved itself to be beneficial in two different THC-based medications. These medications are known as dronabinol and nabilone and are specifically used by cancer patients undergoing chemotherapy and people infected with AIDS. THC in medical marijuana helps with nausea and helps the patients work up an appetite to remain healthy. Both forms of medication have been FDA approved because the benefits simply outweigh the risks for these particular patients. So you may ask, what are the risks? Some physical short-term effects explained by WebMD are dizziness, shallow breathing, red eyes, dilated pupils, dry mouth, increased appetite, and slow reaction time. WebMD explains the long-term effects as withdrawal symptoms such as irritability, cravings, sleeplessness, and less appetite when you stop using marijuana. Although there are risks to using marijuana, medical marijuana is specifically the use for medical reasons because doctors believe it is more beneficiary than destructive. For example, some conditions that are commonly treated with marijuana are AIDS, Alzheimer's disease, arthritis, asthma, cancer, gastrointestinal disorders, seizures, glaucoma, hepatitis C, migraines, and the list goes on. Although there can be negative side effects to recreational marijuana use, which is the use of marijuana without a prescription, the purpose to legalize medical marijuana is to treat particular conditions such as these that can benefit from THC. Marijuana differs from many legal man-made drugs because it is natural in a plant. Because of this, can it really be considered a medicine? Many doctors say yes and few say no. But the definition of medicine according to dictionary.com is the science or practice of the diagnosis, treatment, and prevention of the disease. As explained earlier, medical marijuana is in fact used in medicine for the purpose of treating these negative side effects due to serious medical conditions. So why wouldn't medical marijuana be legally considered a medicine? Just like any other prescriptions, doctors must be convinced that a patient actually has a need for this drug before actually prescribing it. It is important to keep this in mind when determining whether legalizing medical marijuana can be a good or a bad thing for our country. According to Marijuana Project Policy, over 149 million people in the United States currently have a need and obtain a medical marijuana card that allows them to purchase medical marijuana. This number is only the amount of people that live in legal states, so you can see the nationwide demand for medical marijuana. It is important to raise awareness of the benefits of medical marijuana so that more Americans understand the importance of medical legalization. I hope you have a better understanding of what exactly medical marijuana is, how it is helpful to ill patients, but can still be harmful to the general public. And although it is considered a medicine, it is not a medicine recommended for everybody. The argument whether to legalize medical marijuana has been around for centuries, and it is an argument that is not going away anytime soon. Many people agree that the legalization of medical marijuana would help patients everywhere, while others still believe that it is too risky and may even spark addiction with users. As scientific research continues, more and more doctors are agreeing that medical marijuana does help patients around the country, and it may be the most effective medicine for some of their patients. It is important to raise awareness about what exactly medical marijuana is and how it may offer medical benefits to people around our country. As more and more doctors become convinced that legalization will actually benefit our country, the number of medical marijuana supporters also continues to rise. Will medical marijuana ever become legal nationwide?